don't mind. We are gathered today to really look at how to optimize our brain health and talk to an expert. And I'm going to introduce some of the folks on this webinar right now. But if everyone in the chat could put where they're from, it would be great to see who is joining. People. We're in Napa, for those that don't know that. We're streaming from Napa. And again, if you could just put some information in the chat, maybe Veronica could read it out. Anyone in the chat?
Hi, Melissa. I am monitoring the chat. Dr. Green says I need you to release my video. You saw that. Okay, great. And then I think Wendy had a question as well. I'm not seeing it. I think we're just saying hi's.
Yes, we're just saying hi. We're letting everyone just come on to the chat. And I'm just helping out our panelists who are going to join us today. Yes, I see people are using the raised hand function. It's the advances of modern technology and it's trying to figure out how to support that. 1 second, please. Everyone's raising their hand. Does everyone want to put in the chat where they're from? That would be great.
So Wendy just texted me that the chat is disabled.
Oh, that's unfortunate.
Yeah.
Okay,
but,
well,
but I see some responses. So
yes, in the Q&A. 1 second, everyone. All right, we'll get this going in just 1 moment. I'm having a little technical difficulties. Veronica, do you want to introduce who you are and then we'll go from there?
Sure.
I just need to get Dr. Green back on here.
Okay. Hi, everybody. My name is Verona Ladd, and I am the facilitator of Mind Boosters and MasterMinds classes. Both classes are based in total brain health that you're about to hear from the founder and the president of Total Brain Health, Dr. Cynthia Green. I've had the pleasure of training under Dr. Green a few times, and I just am thrilled that you have all taken the opportunity to meet and hear from Dr. Green. She's going to be presenting the very latest in brain health, research, science, and some tips on how we can improve our brain health. And that's exactly what is taught in the courses, Mind Boosters and MasterMinds. And I hope that everybody, I think probably everybody here today on the webinar is either already associated and attending Mind Boosters and or MasterMinds. But if you want any more information about either of those classes, please let Melissa know or me if you have my contact information, and we'll be happy to contact you. Is Dr. Green back, Melissa?
I think you can hear me. Hi, everybody.
Yes, Dr. Green, I'm gonna.
I just can't start the video, but I'm so excited to have the chance to speak with all of you today. Melissa and Verona, thank you so much for having me. And we have a lot of exciting stuff to cover on brain health and about the work that you all have been doing at Providence in a partnership with Total Brain Health, and also all the other great work that you've been doing around brain health for the folks that you serve.
And I think if you're all right, Dr. Terry, well, we are going to go through the presentation. I will start and I will fix what's going on as we go. Is that all right?
Sure.
Okay. All right. So we'll start this. 1 second, everyone. All right. Can everyone see the presentation? I guess just raise your hand if you're able to. And we will start this from here. So again, thank you everyone, and I'm sorry about the glitches on technology. And I'll let Cynthia, Dr. Green, talk about herself, and I will go from there.
This is always my least favorite part, talking about myself, but I'm happy to do that. Thank you so much. So as Melissa and Verona mentioned, I'm Dr. Cynthia Green. I'm the president of Total Brain Health, and I have expertise in this area because I'm passionate about making the brain health science accessible, sustainable, and fun for everybody. By background, I'm a clinical psychologist, and I serve as an assistant clinical professor of psychiatry on the faculty of the Mount Sinai School of Medicine here in New York. Our programs at Total Brain Health are aimed at making that science, and we're going to talk today about some of the current science, something that you can easily learn about and take home and do and kind of really make actionable in your own lives, both to lower risk for dementia, but also for those of you who are living with a diagnosis of memory loss or who are supporting someone living with a diagnosis of memory challenge, giving you the tools that you can use to help address those changes, to maintain a good quality of life, and potentially, depending on that science, impact the progression of the disease. So we're really about making cognitive enhancement accessible and understandable, and giving you the tools that you can use to make your brain health the best it can possibly be. Melissa, did you want to go ahead to the next slide? Thank you. So the Total Brain Health platform really rests on lifestyle and well-being. And I know Verona is going to talk about this with some folks who participated in our programs at Providence, as well as part of this presentation. I'm excited to speak with Frank, who's been attending the program, and his daughter, Linda. But this is what you're going to be learning about. We're going to talk about why this is backed up by the science. But we look across the full body of the research around cognitive enhancement and healthy aging, and have really kind of put forward in our programs the ways that we can all change our lifestyle and manage our lifestyle to really give us the best foot forward for our brain health, both in terms of our everyday thinking, as well as our long-term cognitive vitality. And when we look at that research, what we see consistently over decades is that if we engage in lifestyle interventions that support physical, intellectual, and social and emotional well-being, that it improves our chances to maintain sharper thinking, to remember better, and to promote better cognitive health over our lifespan. This includes different action points along those pillars of well-being, such as eating smart, paying attention to our diet, getting regular exercise, and managing things such as medications and fall risks on the body side. On the mind or intellectual side, we see strong evidence supporting the use of intellectual engagement, so stretching our minds, doing things like challenging ourselves to learn new things, to be engaged in creative pursuits, etc. Sharpening our skills, so maintaining cognitive skills such as attention and memory by challenging them, and also by using strategies. By strategizing to remember better, we can, in fact, improve our ability to remember things like names, conversations, and the like. And then finally, on the social and emotional pillar or spirit side of Total Brain Health, we see that engaging in our lifestyle and being more social, in staying emotionally balanced, so in paying attention to our mental well-being and promoting good mental health. And also, very importantly, and something I think people don't really think about in terms of its impact on our thinking and believing in ourselves. So having confidence. I like to quote Henry Ford on this, who once said, whether you think you can or whether you think you can't, you're right. And that holds true for your brain health as well. This is held out by organizations such as the World Health Organization, who talk about successful aging in terms of self-efficacy, because we're more likely to engage in taking care of something like our brain health, by getting exercise, by challenging ourselves intellectually, if we feel it will make a difference and is under our control. So we call that self-efficacy, and that's a very important part of the Total Brain Health Blueprint. So altogether, this here is our Total Brain Health Blueprint, and this underlies the work that we do, including the programs that are offered to you through Providence. Oh, look, thank you very much, Melissa. There I am. So let's look at some recent science that has been released that we can, just think about in the context of that Total Brain Health Blueprint, and understanding that that is based on decades of research. But there's some new studies that Melissa and I felt would be really interesting to talk about today. And so let's take a look at those here. This first study is from something called the Lancet Commission on Dementia Prevention, Intervention, and Care. This is a very prominent group of researchers from around the world who have looked at the data on dementia, both in terms of what we can do to lower our risk for dementia, in terms of the interventions that are effective for those who are living with dementia, and the care protocols that also are most effective for those living with memory loss. They first published research on this in 2017. There was a follow-up article in 2020, and now one released this past summer. And what this Lancet Commission has consistently found is that when we look at lifestyle interventions across our lifespan, that there are interventions that can lower our risk for dementia. Now, they look at this from a global health perspective, so they're looking at on a population basis. But what's interesting is every year every time they revisit the research, they find additional lifestyle interventions that can really make a difference in lowering that risk. And what they suggested, and we can go to the graphic, is in 2024's article that fully 45%, that is close to half of the dementia that is seen globally, could be ameliorated, could be eradicated by addressing, I believe it's here, 14 or 12 lifestyle interventions. And Melissa, I think you have the graphic on the next slide.
I do. And now that we're here together and we can see Dr. Green, I have a few questions regarding is it important for people, do you think, to read these articles? Would it be interesting for this to be distributed? What do you think for someone who's in the community?
So I think that these articles, it depends on the individual. So if you're someone who has a background in healthcare or who just likes to digest the science, these articles could be very interesting for you to see and read on your own. I would recommend also reading a digest of them. So there are several organizations such as the Alzheimer's Association, or there's a service called Medscape that some people might know, where they've written synopses of these articles. Both of the studies we're talking about were very well covered in the press. So I know, for example, the New York Times covered both of these studies because they were very prominent studies. Melissa, I know you have the articles, so if anyone would be interested, I know that they can get that from you. Yeah. We actually have a white paper, we call them Total Brain Health Insights articles, on the second Lancet Commission study. We haven't updated for this one, but I'd be happy to share that as well with you, Melissa, for you to forward to anyone who's participating today. Perfect. Who wants kind of a synopsis of the findings.
Yeah, I am always interested because you can Google so many different things and what to think is trustworthy and what is not. That's what the interesting thing is. And so I'm really glad that you've expanded on the science behind it, because we could just go crazy with Googling. So it's
Yeah.
the next.
And I think that's an important part of the service in partnership that we try to offer from Total Brain Health, and that Providence has taken advantage of, is that we study all this for you. And so that advantage is that we're experts in this area. So we can discern the wheat from the chaff, so to speak, so that you don't have to do that legwork. And you can be confident that because we are experts in the area, that we do that work for you, that we look to the studies that we feel are really reputable and deserving of your attention and deserving of understanding, to make it easier and turn those into programs that you can benefit from at locations like Providence. So I'm talking here right now about the figure on the left, on the right. Sorry, let's just focus on that one, because I think this is really kind of a really interesting information from this particular body of the Lancet, this commission, the Lancet Commission, because what they do is they look at these lifestyle interventions across the lifespan. They were one of the first to do that. And some of these things are not in our control, but I counted before I got on the call to refresh my memory. And I would say to you, really only 2 of these are not in our control. So the first in early life is less education, and they define that as education before the age of 12. So any education after the age of 12 was thought to be beneficial, but being, missing out on education after that age they thought proportionally accounted for about a 5% of the variance, or the percent being global, what those percentages are. And then if we jump to midlife, you see that a lot of these things are really in our control. And I love that they did this for midlife, because some of you on the call may be at that stage of life. You may be caregivers. You may be a family member who's concerned about your own risk if you have a relative who developed dementia. And so I want you to look at the percentages here of how much of the variance in dementia risk is accounted for by these things that are interventions we have under our control to manage. Things like hearing loss and high cholesterol, diabetes, smoking, hypertension. And while some of these things we could be diagnosed with, it's not whether or not you have them, it's how they're controlled. So I like to make that distinction for folks. So if you have a diagnosis of diabetes, for example, it's not having the diagnosis itself, it's that having an uncontrolled diagnosis of diabetes. So not managing it by diet, exercise, or medications, that would contribute to that risk. But so many of these things, like physical inactivity and smoking, are within our control. And it just accounts for so much of the risk of that 45% in terms of those choices. When it comes to late life, there are still things, obviously, that we can manage. A very significant portion, 5% here is a very significant percentage of late life dementia, was associated with social isolation. So I think that's a really great message in terms of the real importance of being socially engaged. It's one of the things we point to on our blueprint. I love seeing it confirmed in studies like this. It's something that's a very integral and important part of our total brain health programs. Visual loss is a new one here for the Lancet Commission. And there are things we can do, of course, to help address visual changes that we might have. Not necessarily all of that is in our control, but some of that can be. And air pollution, I thought that was really interesting. And that is another one, like less education in early childhood, I don't know that we necessarily have control over. But this is 45% of the risk for dementia, right? So these are things that are modifiable that we can change to lower that risk.
I think a lot of the times we hear about hearing and how that is. So could you maybe touch upon hearing, and just for everyone to know, the chat is open. So please share questions and comments if you'd like throughout.
Yes, I look forward to everyone's questions. So hearing is a big one. Many years ago, we partnered with a company that served people with hearing loss on an understanding, a campaign to help people understand the relationship between hearing loss and cognitive health. And there's a very strong correlation between hearing loss and dementia risk. Both clinically, you see that here from a global population basis, but clinically speaking as well. We know that people who experience uncorrected hearing loss, so again, uncorrected, right? Not using hearing aids, not having hearing aids that really address the issue. And that is not people who are born with hearing loss, but more people who get during midlife might develop hearing loss, that there's just an increased risk for dementia. And I think if we parse that, right, if we try to understand what the science might be behind it, and this is a correlational finding. So that means that we see that having hearing loss increases the risk for dementia, but they kind of coexist in that way. Outside of random chance. It doesn't mean that hearing loss causes dementia. So how could hearing increase risk for dementia? Well, one thing might be that it increases social isolation and cognitive stimulation. So when you have uncorrected hearing loss, it might be more difficult to engage with other people. It might be frustrating. And so there might be a real disincentive to going out with friends, to joining social outings, because if you're having difficulty hearing, you might feel uncomfortable or feel that you're at a loss to really be engaged. So having hearing loss that's not addressed can increase your social isolation. And we know social isolation is also a factor in increasing dementia risk. The other thing is that when you experience hearing loss, if you do kind of limit your participation, you may also have less intellectual engagement. So you may find that you don't, go to concerts or lectures or, do the things that you used to do that are harder because of the hearing loss. And that intellectual engagement, we know, is a very important factor in preserving cognitive vitality. There have been some studies now, decades ago, some of the earliest studies actually in lifestyle and dementia risk looked at intellectual engagement, what the researchers called cognitive leisure activities, which I think is a terrible term. But there are some studies out of places like Rush University in Chicago and the Bronx Aging Study out of Montefiore Hospital here in New York City that showed up to close to a quarter of those who experienced less or diminished intellectual engagement were more at risk for developing Alzheimer's disease or related dementia. So I think that, Melissa, is a way that hearing loss plays a very significant role. It is kind of a secondary risk factor that affects these other lifestyle interventions and our ability to participate fully in them.
I just think it's so interesting how everything kind of intertwines into brain health, and one thing, if it's a little off, can impact everything else. So if anyone has any other questions around risk factors that they've been thinking about, please put it in the chat, and Dr. Green is here to answer all of those in-depth science questions. Sorry.
Yeah. No, I just want to say about hearing loss too is, it's interesting because I've been doing this a little while, and it's interesting to see, it used to be the technology was very bad, right? And the technology I know isn't perfect, but it's so much better than it used to be. Now the cost, it's easier to access hearing aids, right? In the recent year or two with the changes in access, and also, with Medicare coverage, I know sometimes it was much more difficult. So now that hearing aids are more accessible, it might be easier for people. The technology is better. So if anyone's listening who has had hearing loss and maybe, has been frustrated over the years and kind of, I have my parents, my father's had some issues and has struggled to find hearing aids that he found to be comfortable. And it is a little bit of a journey, but I hope that this might be a motivation to maybe revisit that for you.
There is a question in the chat around someone having hearing loss for many years and in their older 60s around kind of having this. What is the percentage around the changes and like what helps with the hearing aids and corrections once they have it corrected? So here, 30 years after having hearing loss.
Yeah. So Lorelei, thank you for that question. I think that it's very hard to know. I just think that there's not any studies that will show us, right, the impact. And this could be true for any of these lifestyle factors. So, you know, someone who hasn't exercised, right, who suddenly decides that they want to take better care of themselves and enters into an exercise program. It's really hard for us to know what the kind of impact is of not having been exercising in the previous years. So I think the most important message is we can only look forward, right? So we have control now of what we do ahead of ourselves, not what we've done in the past. And what we should do is look to optimize our lifestyle using the Total Brain Health Blueprint, looking at studies like this, and look at ways moving forward that we can take better care of ourselves to really optimize our cognition and healthy aging. Thanks, though. It's a great question. I'm sure other people had the same, even if it wasn't about hearing, about something else.
Thank you so much. So we are going to move on to really our collaboration over the years with Total Brain Health and what we formerly were Calabria Care, but we are now Providence Adult Day Health in Napa Valley. And we have had a robust relationship with Dr. Green and Total Brain Health, and whether it's our training and their staff or any of the programs that we have associated with the Blueprint and her programs. And I'm going to have Dr. Green jump into them in a few slides, really talking about what those programs are. But maybe you can chat about some of the staff training that you have or what that even means with the professional certification.
So we have a number of different ways that we support professionals in the field. And we've been really grateful to have such a strong partnership over the last several years with Providence. So one of the things that that your team has done is to make sure that you've taken advantage of everything we have to offer, including a brain wellness certificate program, which is not training in our programs per se, but really a deep dive training into the brain health science, really about what we've been talking about in terms of understanding the research behind lifestyle interventions, as well as behind memory training. And so you've had many of your team members go through and gain certification. It's a 6-hour training. It's the live training with me directly in small groups. So there's a real intimacy to it as well for the professionals. And so we've been really grateful to get to know your team members, to see how dedicated everybody is to bringing this research and these programs to your communities, and to really understand the science in a very granular and deep way so that you guys can answer some of the questions that are coming up in the chat. The brain health programs that we provide are programs that target different areas of cognitive enhancement, and Providence has had several of them over the years. That includes our program on brain workout, which is a lifestyle wellness intervention program. It trains across that Total Brain Health Blueprint that I had shared earlier. Our memory program, which helps those who are cognitively independent learn how to use memory strategies to remember names or conversations or things that we read, see, or hear. And our Flex program, which is a program that serves people living with early stage cognitive challenge, or what people might call mild cognitive impairment. And that is a wellness program that looks mostly, again, at the Total Brain Health Blueprint and at lifestyle, and how things like exercise and socializing and challenging our thinking can help us address living with early cognitive change.
Before I jump to the next slide, Dr. Green, there is a question around kind of the familial aspect of Alzheimer's and dementia and kind of how that plays role into one's life, and maybe addressing that a bit.
Yeah, that's a great question. Thank you so much to whoever asked that question. You know, there are different types of genes that contribute to Alzheimer's risk. Some of those genes are carry a greater risk. Usually that's for families where we see early onset are what we would describe as onset before age 65. It's a little bit of an arbitrary cutoff, but that's the cutoff that we tend to use. And in that kind of early onset Alzheimer's disease, there are certain genes that seem to be carry a more dominant risk for those family members. However, those types of dementia cases or that kind of familial risk is relatively rare. There was a gene identified several decades ago by a team at Duke University, which is the ApoE4 gene. And that is a cholesterol gene. ApoE comes in 4 identified variants, 1, 2, 3, and 4. And as many of us may remember from our science classes in biology in high school, we have 2 pairs of every gene, or a pair of every gene, 1 from each of our parents. So when we look at ApoE, we could have pairs and they can come in any of those combinations, right? We could have 2 and 4 or 1 and 4. There is evidence suggesting that people who have both alleles 4, so they have ApoE4 in both sides of that pairing, will be at increased risk for Alzheimer's disease. But I think what's most important to understand is that there's a lot of evidence that even with that risk, that can be modified based on lifestyle. So, for example, there have been some important studies, including one that was released a year ago, last summer, I think it was in July of 23, that looked at genetic risk based on the ApoE4 profile of the individuals, and found that lifestyle factors, so as the ones we've been talking about here, modified that risk significantly to lower it. And that was out of the UK Biobank studies, which is a very large longitudinal study. They have data on thousands of participants, and so it was a very robust finding. And there have been others like that. So I just want to reassure people so that even if you carry an ApoE4 gene in both sides, that there's a lot of evidence that doing things in terms of your lifestyle can really modify that risk. It's called epigenetics, right? It's the impact of our environment on our genes and how those genes are expressed. So it's something I think we all find maybe a little concerning, right? If we feel that we might have something genetic, but I want to reassure you that that research suggests that lifestyle stuff that we're talking about still really can matter and make a difference in terms of the expression of that gene.
Thank you so much for that deep dive. And our partnership continues with kind of the philosophy of care that we have here in Napa for Alzheimer's Daycare Resource Center. And we've been an Alzheimer's Daycare Resource Center for over 25 years. And it really does touch upon the Total Brain Health Blueprint with our early intervention programs that we just saw, our Mind Boosters and our new MasterMinds program. But we really do so much more for the community with our no-cost consultations to folks that are either have a diagnosis or don't have a diagnosis. Our adult day program that I'm going to look at a little bit more with everyone, our support groups, and these can also create social interactions for caregivers and those that are supporting others around them, because sometimes this process can be isolating. So there's other opportunities. We like to think we're the one-stop shop, but this is something that we are offered, and Dr. Green's philosophy of the blueprint for total brain health really aligns with everything we're doing. And I know that you touched a little bit on the 2 programs. But as I had mentioned, we have our Mind Boosters, which utilizes the Flex program, and then our MasterMinds, which some of you who have joined programs in St. Lena, it used to be called Brain Fitness, but we did a relaunch so that we could really incorporate Dr. Green's material. So I don't know if there's any other aspects you'd like to talk about the 2 programs, Dr. Green.
Yeah, so these programs give you a great opportunity to work with folks who have been trained through us, and can teach you about 2 very different aspects, right? About wellness and about lifestyle interventions and about memory improvement. So as I mentioned before, the FLEX program is designed to serve those living with early stage cognitive challenge. And it's a very unique program. There's not another program that I know of like it available, serving specifically folks who are living with early stage memory loss. It focuses on lifestyle. So it focuses on these body, mind, spirit interventions and talks about the science behind each of them. That you can learn how exercise can help if you're living with early memory loss or being socially engaged. One thing, Melissa, I'd really like people to understand is that when they come to a total brain health class at Providence, they're not going to just be sitting and listening to someone talk. Our programs are highly interactive and they're highly social. And dare I say, they're really fun. So one of the things we hear back all the time, and I know you do also, is that people really enjoy coming to the programs. They love the opportunity to really get to know the people that are in their class and to work together to master the material. And, you know, my philosophy on that is if it's not fun, I wouldn't want to do it and I wouldn't want to keep coming back. So it's really important to us that it's very scientifically grounded. You're really learning why these interventions matter, but you're going to have a good time doing it, and you're going to do it in the company of others where you're really learning together. So our programs are all very interactive. The heart of each and every total brain health class is going to be an activity that you're doing a workout that you're doing with each other to understand the material by doing it and to really have something that you can take home, right, and keep doing on your own. And that's true for the memory class that you're offering through MasterMinds as well. This memory class teaches memory improvement. So folks are going to learn in that class how lifestyle impacts our ability to remember better, how age impacts our ability to remember better, but also things like stress and exercise and diet. And then it moves very quickly into learning memory strategies. First, by learning memory strategies generally. So how we can remember all different kinds of information, and then taking those memory strategies and applying to the things that you really want to learn how to remember. You know, the biggest complaint that most of us have is remembering names. So you'll learn how to apply those memory strategies to remembering names, but also to how to remember a conversation or where you put something, or what you might have watched on TV or read in the newspaper. So it really gives you an opportunity to master those strategies from many different angles. And it's a class people really enjoy because it gives them tools that they can apply for forgetting, right? Which is a frustration for all of us.
And you all had a little sneak peek when we had some technical issues with Verona, and Verona is our fearless leader in these two programs and some of our other programs throughout the community. But it is really engaging, and not only are we able to utilize this material, we also utilize our own philosophy, but it could not happen without the support from our foundation, all of the support that they've given us through the funding, but our Community Health Foundation in Napa Valley is really brought this possible. Even today with Dr. Green joining us, we could not offer this to the community like we do without that ongoing support that they have provided us. So I always really appreciate their support, their understanding, their realization that brain health is so important for the continuum of our overall health. So I just wanted to make sure that was noted for everyone on this call today to know that this could not happen without them. And so just a little highlight of also what we do with our blueprint, I guess you call it, but it's not a blueprint because it's our 5 domains of brain health, which has really been always inspired by Dr. Green's philosophy and those within the science, right? She's talked a lot about what the science is behind brain health. And so we really look at some of those and take it into our own interpretation about spirituality, socialization, nutrition, exercise, and cognitive stimulation. And those are all base of our brain health classes. So we really look at that, and I find it very important to highlight that. So it's very complementary. It's very inspired by everything Dr. Green has put in for years of her dedication to making sure all of our brains are aging properly. And so I appreciate that so much. And I know that everyone that has been in our Mind Boosters and our Brain Fitness and now our Mastermind classes also can definitely feel and see the benefit. And Verona, and we'll have also an interview from some of our participants that are in the class just in a bit. But we are also looking at what our day program does. And so with the continuum of care, we also have an adult day program here in Napa, which serves Napa County and beyond. So if you're interested in touring the day program, we have two programs of social model and the medical with social. And so those are really important for people that need a safe place or just want to connect and keep social during the day. And so that we offer that. And so if you're interested, please feel free to contact myself. And I can happy to set up a tour, happy to connect you with one of our social workers. I do see that there is a chat or a note in the chat from Derek. If Alzheimer's runs in the family, is there a test that you can be taken to see if it's possible? So I guess he's just wondering if there's tests out in the community around seeing if you are more prone to, is what I'm interpreting that as.
Yes, and there's genetic testing available, but I would just make sure, Derek, and anybody else, that if you do decide to do a test, that you do it in the care of your health professional, such as your primary care physician or another appropriate resource, because you want to make sure that those findings are properly understood, because as I said, they're not really determinant, right? And I think that it's very important to have genetic testing done with counseling if you're going to, or you feel it would be helpful to you to understand what your genetic risk might be.
Another question, and I think it's a little bit about our program, but Dr. Please let us know for the classes that are here locally in Napa County. You can join. We do a memory screening. So we use what is called MOCA during a consultation with our social worker to really just understand what you're looking for. We don't need folks to have a diagnosis to join any of the programs. But if you do have a diagnosis, that's where the memory screening can really help, because we don't want folks to fall behind in any of these classes. We want them to feel successful. And so if it's something where you're no longer appropriate, or it's not an appropriate class for you to join, we will probably talk about other programs that are available, such as our such as our day program. But there is no really criteria beyond if you're feeling memory changes, and we'll assess it from there. And I think there is a question, is the APO4 test a genetic test?
So yes, it is a genetic test for the APOE for allele, or for APOE testing.
Is that readily available, Dr. Green, or is that something that's of cost?
That's actually something, since I'm not really, I don't really know. And that would be something, again, I would ask my doctor.
Mm-hmm. So we are now going to enter into an interview format. Our gracious participant, Frank, and his daughter, Linda, is joining us today. And we're really going to have a great conversation with Verona, who introduced herself earlier. And I hope that there's not going to be any technical difficulties, but Frank and Linda are going to join us, I hope, in just a moment. But maybe, Verona, you can expand on the program, and well, that's happening. I'll find Frank and Linda.
Yeah. Well, I'm just enjoying looking at their wonderful picture. They're just so wonderful. I can say that I would wish that all caregivers were as proactive as Linda is being with her dad. I mean, I see that there's not only caregiving, I like to use the word care partner, because it is a two-person relationship. It's not just we're giving to a person that needs a little help around cognitive issues. But I really see their relationship getting deeper just through Linda's proactive approach to helping Frank. I can see that she's learning as well when she sits in our classes. So they're learning together, and that's a really wonderful thing. And I'm just so thrilled that they're willing to be with us today.
And speaking of Linda and Frank, here they are. And if there was a crowd, and if there was a crowd, we'd be clapping. I think they just jumped off. Let me just help them again. Okay, there we go. Hello, Linda. Hello, Frank.
Hi.
Hello.
There they are. Hi there.
Hi.
It's so great to have you here.
Thank
So
you.
Melissa, did you want me to go ahead and just start with questions to Frank and
Yes.
Linda? Okay.
Yes. Let's
So,
hear the story between
yes,
Linda and Frank and with Verona.
for everybody else, Frank is an active member of now both of our classes, the Flex program, the Mind Boosters, and the Masterminds. And Linda has joined him in the last two Masterminds, and I think it's a wonderful thing because then they can reiterate the information that they learned in the memory class later on afterwards when they go to lunch, or they could practice some of the exercises together at home. So I just think having the caregiver and the participant together working on this together is just, it's a wonderful thing. So Frank, I'm going to start with you, and I'm going to ask you the first question. In your own words, there's no wrong answer, as you know. What concerns you the most about aging and your memory?
Well, I think the main concern is that you don't want to lose or diminish your memory. And so you'd like to know if there are steps you can take to maintain it or to improve it.
Okay, good. Now, does Dr. Green want to jump in and answer that, or
Sorry, Verona, I didn't mean to interrupt you. What were you going to say?
Oh, I just didn't know whether, if Dr. Green's going to answer the questions as I asked them. Is that what you had in mind?
And no, first of all, Frank and Linda, it's so nice to meet you. So hi.
Hi, nice to meet you too.
I think I'll jump in as you would like, but I think it's just so great to hear from Frank and Linda about their experience. And Verona, you have had so much experience with our programs and with our training. So it's lovely personally to see you guys, and hear about the experience. So
Oh, okay. I'll share a wonderful little thing that happened yesterday in the memory class, and Frank and Linda were both in it. It was around keeping track of it's called a speed game, or a brain going fast. We put a little pressure on ourselves to go a little faster. It kind of like going to the gym and adding weights to your muscles so that you get a little bit more of a workout. So I was doing a timing exercise, and I didn't realize how uncoordinated I am. So I had to practice it first. And I went into class going, okay, guys, we're going to learn this together, because I'm discovering that I'm not as coordinated as I thought I might be. This was not an easy exercise at all, but we did it together. I got better, the group got better, and within the 15 minutes we were doing this one exercise, I could look around the room and see, oh my gosh, everybody is getting it. And I would layer on another task on top of that. We would switch from maybe counting to remembering everybody's names. And it was a beautiful experience, because by the time we finished the exercise, everybody could go around and say each other's names. And I was just so thrilled to see that happen. What you said at the beginning, Dr. Green, about you only do this if it's fun. Yeah, it's fun. We have a lot of fun in our classes, because it could be a little dry and maybe intimidating if we didn't throw in some fun. So the day that we did improv, wow, everybody stepped out of their comfort zone, and we were, doing improvs just like they do on TV. We even showed the old Lucille Ball and Harpo Marx mirror segment that is just a classic now. So, we really do have fun with our classes. And I wanted to say specifically about Frank, and because I share this with him, the hearing loss. I keep telling our participants that if you don't hear the information at the get-go, how are you going to remember it? So make sure that if you have to say, please repeat, do it, because you need to take in the information so that you can remember it. And under spirituality, you said, believe in yourself. So I sometimes get on my bandwagon and I will say, don't apologize for having to ask people to repeat themselves, because that is tiring. I've been without hearing loss temporarily for a while, and I remember starting to get socially isolated and wanting to stop apologizing to ask people to repeat themselves. Luckily, it was temporary. I have a bionic ear now. But I know what that feels like. And so I just want to encourage people to not let hearing loss get in the way. It's really part of the other person's job to make sure that they are being heard. If they want you to get the information, they need to also speak articulately, maybe lower their register, because I know that the high tones sometimes are lost in hearing loss. But anyway, I'm just so happy that Frank is here today with us. Okay. Next question. Again to you, Frank. What do you find most enjoyable about attending Mind Boosters?
Well, well, first of all, it's sort of a new thing to me, and anything that you can do to improve yourself is to me is good. And so I feel like I'm really trying to improve myself, and that's what's important.
Yeah. Frank used to be a math teacher. He has a very successful career in being a math teacher. So when we did one class that was all around math, he was like, piece of cake, no problem. And every one of the exercises he really excelled at. But it's that use it or lose it thing that we discovered too, because there's some other areas around languaging and words that it's not the one that Frank excels at, but boy, does he excel at numbers and math. So I thought that was interesting too. So Frank, I'm going to ask Linda a question now. Linda, you ready?
Okay.
What concerns you most about your dad's aging and memory?
I think that his memory will diminish to the point where I would question, will I be able to care for him in the house? I mean, that is my goal. I did it with my mother. I want to do that with my father. And, what challenges will be ahead, and am I up for those challenges?
Yeah.
And then it's just that, we have a lot of wonderful shared memories between my parents and me. My father's the last surviving parent. And, someday there'll be nobody to share those feelings with, and that's distressing to me.
Yeah.
Yeah.
Well, I just want to encourage you to be here now and
Yes.
keep building on those memories while you can, and then revisiting them through photo books, through telling stories, because you can still do that. And that is a lovely thing that you guys can still share. Recording his voice. I don't have my parents anymore either, but someone suggested, and I'm glad they did, to record their voices, because you can keep pictures, but you don't necessarily always have their voice.
That's true.
Yeah.
Yeah. Yeah.
Okay. I'm going to ask you another question, Linda.
Okay.
What benefits have you noticed in your dad since he's been attending Mind Boosters?
Well, I was just so surprised, like the first time he came out from a Mind Boosters class, and ever since, his face is radiant. He's just so happy, and I didn't know what to expect, but he really looks forward to the classes, and it seems like it's a great motivator for him to cooperate with me on his personal, care. So I just think, just seeing that joy in his face, that's enough for me,
Yeah.
Yeah.
Yeah, we know that some details can get forgotten, but the emotional memory is really strong, and that's what lasts. So keep that in mind, any caregivers that are out there. It's about connecting on their emotional memories as well.
Yeah.
And Verona, if I can jump in and just say, that makes me so happy to hear you say that, because I think that, Frank, it's about having that opportunity to do something for yourself, right? So, by the way, I've always been terrible at math. So, it just proves that, dementia's, it's just diagnosis, right? In the same way that we have other diagnoses, we're still who we are, right? So you still can go in there and be great at the math and someone else might not be. And there's other ways when you go to class, I hope that you find things that are challenging, but you enjoy doing it. And, it gives us confidence and an opportunity. And sometimes we don't have a chance to feel like we're able to do something to take care of ourselves. So that makes me really happy to hear, because I hear about the look, Frank, that Linda's saying about what's on your face. And I think that I would hope that you're having fun, but that it's giving you confidence in a sense that you're doing something, right, to take care of yourself as well, which I heard you reference before too.
Yeah.
And I think it's important. I was going to say, I just think it's important to think that my dad is 92. He started this when he was 91. So you're never too old.
That's right.
I
Yes.
mean, you just got to get in there and do it. You can still have a good time. You can still learn. So,
Yeah.
That's really good thing to remember too, that you're never too old to learn. One thing that we've incorporated into all of the Flex programs is the process of intentions and affirmations. We have a beautiful labyrinth outside of the door where we have our Total Brain Health Flex program. And I'd love to have Frank tell us in your own words, Frank, what the intention and affirmation process is, because you said it yesterday, and I hope that you'll share that again today.
Well, the intention process is saying what you intend to do. For example, I intend to walk outside today and observe nature. And then
affirmation.
The affirmation is, I'm walking outside and I'm enjoying nature to its fullest. That's the affirmation.
Yeah, it just puts a little punch on your intention to affirm that it's already happening. It's like matter follows energy. Deepak Chopra's teachings around, you really need to claim it as yours, and then you'll see it, and then it materializes. It just gives a little punch to that. So
Right.
that was good. Dr. Green, do you want to add anything to that idea of
So, it's so interesting because we have, as you all know, a kind of breathing meditation that closes each and every Total Brain Health class. And we do that with affirmations, right? Because we know how important that is to our cognitive health and also to our overall well-being and successful aging. So, we really value that. And it's so lovely to hear you talk about it, Frank. And I'm sure that it's, I would hope a meaningful part of the experience in the program. And Verona, I just also want to comment on something that you said earlier that really struck me. And I hope strikes people in terms of the effort and the work that you all have done at Providence to really understand brain health and to really kind of use these programs to their fullest. When you talked about the mirroring exercise, so the mirroring exercise is an exercise that is in one of the classes, which has us, moving, like if I do this, the person will do this with me. And it's really wonderful for active social cueing, which is something that we can maybe use some extra attention for when we're living with early stage memory loss. And it's also an improv exercise. But I never thought to show a Lucille Ball video with a mirroring exercise. I have to get that from you, first of all. But it also shows you the depth of commitment, I think, that, Verona, you have, your understanding from having been certified with our Total Brain Health program, in brain wellness, and also the dedication you have to really learning about teaching these programs, that you can look at these programs and add to it, right? You've integrated them into your own programs, and then you've added it and kind of really bolstered people's experience because you've done that deep dive into understanding the science. So I just wanted to make sure to point that out. Not everybody who teaches our programs has that dedication and commitment. And so I just love hearing that.
Thank you.
I want to thank everyone for joining us, whether they're the panelists or they're on here attending. And I just want to give Linda and Frank one more opportunity. If there's anything else you'd like to say around the programs, or kind of how you're feeling about memory, anything that comes to mind at the moment, just sharing with the audience and us about whatever you feel.
Well, basically, I've always loved to learn new things, or even to improve on the things I already know. So that's what makes everything interesting. And that's pretty much it.
Thank you so much. That's such wisdom. Thank you. And then Linda, what about yourself?
I guess I do wish there was something that I could take home, or that was available from you on YouTube or something that I could say, let's work on this every day. You know, like there's some little lesson we could both interact with, because it's one thing if he does things in class, but I'm not there to see that. So I think that would be helpful, because I think it could be a good part of everyone's day. I know that they give suggestions, but yeah.
So I hear you say you'd like homework. You'd like us to give,
Yeah.
I'm just, yeah, no, but no, but I hear what you're saying in the sense of like, if there was something, because we're all, I mean, I'm a visual learner. I'm not sure if everyone else is, but something that visual to take home and something to grow on. Thank you for
We're
sharing.
actually talking about little homework packets that our volunteer Wendy, who's joining us today, has offered to help with too, because some of these exercises, it's like you don't want to go to the gym just once a week. So why would you want to think that these brain health exercises can sustain themselves through week to week when you need some in between? So yes, Dr. Green, I would even wanted to talk to you about that.
No, I'm just laughing because I hope that my staff isn't on, because we're talking about doing workbooks, and I probably shouldn't say that. But exactly, Linda, for that reason. And there are actually take-home cards in the Flex program that, Verona, you may or may not be using. Not everybody does. But to Linda's point, they're not really like a worksheet that you could do with your dad. It's more like a 1 or 2 line synopsis of what you did in class. The other programs have like 1-pagers, some of them, but that's something we can certainly look to supplement Flex. And now you've given me even more reason to do a workbook, which I think would be a great thing to complement the programming that people could take home.
Yay.
So
For
thank
you,
you.
Dr. Green, just one last word before we are 1 minute over, but I would love to hear one last word of inspiration for all of us on our aging brains, and just something you'd like to offer.
I think Frank has inspired us all. Frank, thank you. I thank you for being willing to speak to everybody and for joining this conversation. I think your message about you should always learn, like no matter who we are, no matter how old we are, learning is such a great way to keep our brains young and vital and engaged, to be social. And I just really encourage everyone to take really great care of their brains, to look for all the ways that we can stay ageless every single day of our lives. So thank you so much for having me. It's really been a pleasure to speak with you all today.
Thank you.
Thank you
Dr.
so
Green.
much. And in the partnership between Total Brain Health and Providence Adult Day Health, I want to say thank you to everyone that's joined. And I will be following up with an email with everyone. And if you guys have questions, please feel free to contact us. Thank you so much, Frank and Linda, for joining us, and Verona and Dr. Green.
Thank you,
Thank
Melissa.
you.
Thank you.
All right, have a wonderful day. Bye-bye now.
Bye, everybody.
Bye-bye. Bye-bye.